So hey guys, what's up? So welcome to World News 20 News channel. So let's talk about can unborn baby be infected? Vertical transmission or mother infected or fetus or newborn is an emerging aspect of COVID-19. A look at the available evidence worldwide so far and ICMR's recent guidelines to address this concern. After several months of the world believing that a pregnant woman cannot transmit novel coronavirus infection to her unborn baby, evidence has been emerging to suggest that this can indeed happen. Earlier this week, the Indian Council of Medical Research laid down the need for healthcare workers and obstetricians to factor in the consequences of the probable vertical transmission of COVID-19, the disease caused by the novel coronavirus, and take precautions accordingly. What is vertical transmission? Vertical transmission refers to the transmission of an infection from a pregnant woman to her child. It can be antenatal before birth, perinatal weeks immediately prior to or after birth, or postnatal after birth. This is of grave concern, not just because it can potentially cause a newborn to very sick, but also because the mechanism of how and when this happens is not always very clear. In a 2017 review article in the journal Cell, host microbe scientists from the University of Pittsburgh wrote, despite the devastating impact of the microbial infections on the developing fetus, relatively little is known about how pathogens associated with congenital disease breach the placental barrier to transit vertically during human pregnancy. Among infections of which vertical transmission has been known to happen are HIV, Zika, rubella, and the herpes virus. In fact, one of the biggest worries about the Zika outbreak a couple of years ago was the possibility of the babies being born with the birth defects. What has ICMR said? ICMR has issued a guideline for management of pregnant women in the COVID-19 pandemic. It says, with regard to the vertical transmission from mother to baby antenatally or intrapartum, emerging evidence now suggests that vertical transmission is probable, although the proportion of the pregnancies affected and the significance to the neonate has yet to be determined. The guidelines deal with the protocol that healthcare workers need to follow, right from notification of cases, antenatal and postnatal care that needs to be given to the mother and baby, and the use of appropriate personal protective equipment so that there is no transmission of the infection from the mother to the health staff attending to her, especially during labor when chances are very high of the baby and the staff coming in the contact with her body fluids. It also follows international norms in recommending that the baby should be isolated after birth, highlighting the lack of enough scientific knowledge about the chances of a COVID-19 infected baby developing complication. It is unknown whether newborns with COVID-19 are at increased risk for severe complications. The transmission after birth via contact with infectious respiratory secretion is a concern. Facilities should consider temporarily separating, for example, separate rooms, the mother who has confirmed COVID-19 or a PUI person under investigation from her baby until the mother's transmissions-based precautions are discontinued, says ICMR document. Incidentally, on April 3rd, days before this document came out, India's first baby born to a COVID-19 positive woman had been delivered in Ames. He's a COVID-19 negative. The baby's father, who is a resident doctor in Ames, and his mother both had tested positive for the disease. What is available scientific evidence of vertical transmission? The science of whether there is a vertical transmission is evolving, much like the rest of our knowledge about the novel coronavirus SARS-CoV-2. On February 12, researchers from one university looked at 9 pregnant women and came to the conclusion in an article in The Lancet. The clinical characteristics of the COVID-19 pneumonia in pregnant women were similar to those reported from non-pregnant adult patients who developed COVID-19 pneumonia. Findings from this small group of cases suggest that there is currently no evidence for intra-rotating infection caused by vertical transmission in women who developed COVID-19 pneumonia in late pregnancy. 10 days later, something happened that changed the understanding of the COVID-19 in the context of vertical transmission. Born positive, another group of researchers from the same university reported in the Journal of the American Medical Association the case of a woman with COVID-19 who delivered a baby girl on February 22 at Remlin Hospital 1. The baby was found positive both for the virus and then antibodies against it soon after birth. It was the presence of the latter that led researchers to believe that the infection happened in utero. The elevated IgM antibody level suggests that the neonate was infected in utero. IgM antibodies are not transferred to the fetus via the placenta. The infect potentially could have been exposed for 23 days from the time of the mother's diagnosis of the COVID-19 to be delivered. The laboratory results displaying inflammation, and liver injury indirectly support the possibility of the vertical transmission, the researchers reported. There are other instances too. Last month, a baby born to COVID-19 positive at the North Middlesex Hospital in the Enfield had tested positive immediately after birth. Two doctors there were uncertain whether infection actually was a result of the vertical transmission or whether the baby had caught in afterbirth from somewhere else. NHS now says, as this is a very new virus, we are just beginning to learn about it. There is no evidence to suggest an increased risk of miscarriage with regard to vertical transmission from mother to baby. The evidence now suggests that the transmission is probable, although there has only been a single case reported. The significance to the neonate is not yet known, and we will continue to accept and monitor the situation for women and babies. The U.S. Centers for the Disease Control and Prevention to still does not subscribe to the vertical transmission school. It maintains mother-to-child transmission of coronavirus during pregnancy is unlikely, but birth as a newborn is susceptible to a person-to-person spread. A very small number of babies have been tested positive for the virus shortly after birth. However, it is unknown if these babies got the virus before or after birth. The virus has not been detected in the amniotic fluid, breast milk, or other maternal samples. So if you like the channel, so kindly subscribe to it.